So let's focus in on our kids here this morning, as two local mental health workers say kids' mental health is suffering now more than ever. And to solve that problem, Broadlawns Medical Center is expanding their mobile crisis team to assist more children, while Easterseals Iowa, they're gearing up to take in more kids to their Crisis Stabilization Center. So our very own Local 5, Khalil Maycock, you spoke with both organizations and why they say it's so important to tackle mental health with our kids head on, especially right now.
Good morning, Jackie. And both organizations say that's important, especially in kids, because they are the future and need to be healthy to function properly in the world.
In general, just mental health has gone up with COVID, and we're seeing it a lot more with children.
Dawn Marie Hooker, the crisis service manager with Broadlawns Mobile Crisis Mental Health Response Team, says it's a problem they want to solve. Right now, the team helps about 13 to 15 kids per month. But based on the calls they receive for help, which include
A lot of depression, a lot of anxiety, the uncertainty.
she knows they need to serve more youth, so they're expanding.
But with the expansion that we're doing, this is going to focus more on the children aspect, and then as well as a response model without officers.
This will focus on giving kids more ways to handle their emotions. And though the response model won't have officers, the program will still partner with the Des Moines Police Department and Polk County Health Services.
And this half is going to be crisis stabilization.
This is the new building that'll house the Easterseals Iowa's Crisis Stabilization Unit. It'll hold 12 children. It's dedicated to helping youth learn how to cope with their mental health. Currently, this is where the children go for crisis stabilization, which only holds 6 people. Since opening in September, CEO Sherry Nelson says it's been at capacity consistently. But she says she's glad they'll soon be able to help more children because they've recently been getting more referrals to help them, but were unable to offer these services because of lack of space.
A child would see a therapist once a day. They would see some specialists. We also have access to a peer support person who would support the family and the child.
Now, Easterseals Iowa says the majority of their referrals are coming from schools, and they're dealing with kids having a hard time adjusting to everything going on right now.
Which we can completely understand. So referrals coming from schools, if parents are starting to see something with their kids, is there a way of making that connection to those resources that you're providing us this morning?
Yeah, so for the first one with Broadlines, their crisis mobile unit, you can call 911 or they have a non-emergency hotline, and that can get someone to your house to address those issues. And then for the one at Easterseals, you have to be referred there, so either by a mental health counselor, or if the school is noticing an issue, they can refer you to those services.
Great information.